Good morning, everyone, and welcome. I am Irshad Ahmed, a medical lab technologist from the Department of Cardiology at AIIMS New Delhi. Today, I am excited to introduce our presentation on electrocardiogram, commonly known as ECG or EKG. Over the next few slides, we will explore what an ECG is, how it works, and its importance in diagnosing heart conditions. So let's get started and dive into the world of cardiac diagnostics. Let's take a closer look at what an ECG or EKG actually is. It's a simple test used to check the heart's rhythm and electrical activity. Essentially, what we're doing is recording the electrical signals that your heart generates as it beats. When we look at an ECG, we see a graph that shows voltage over time, which reflects the electrical activity of the heart. This visual helps us understand how well the heart is functioning and identify any irregularities. So, what exactly is an ECG or EKG? It's a painless and non-invasive procedure, meaning it doesn't cause discomfort and doesn't require any invasive techniques. That's why it's such an important tool in diagnosing many common heart problems, giving us quick and vital insights into heart health. Overall, this simple test plays a crucial role in our ability to assess and monitor heart conditions efficiently and effectively. Why is an ECG so important? Well, it helps us detect various heart conditions that can significantly impact health. For example, arrhythmias are irregular heart rhythms that can sometimes be harmless, but other times need attention. Then there's coronary artery disease, or CAD, which is a major cause of chest pain and can even lead to a heart attack if not managed properly. We also look at how pacemakers work, especially when they are implanted to regulate the heartbeat if the heart's natural rhythm is too slow or irregular. Another condition to be aware of is cardiomyopathy, where the heart walls become thickened or enlarged, affecting how well the heart pumps blood. Finally, there are general heart problems, like experiencing severe tiredness, shortness of breath, dizziness, or fainting. All these signs can point to underlying issues that an ECG can help diagnose early. So, understanding these key points shows us just how vital ECG testing is in maintaining heart health and preventing serious complications. Now, let's take a closer look at baseline tracing of heart function. This involves comparing current ECG results with past or future ones to identify any changes over time. It helps us see how the heart's activity is evolving, which is crucial for accurate diagnosis and management. Next, we consider heart health in the context of various procedures. Whether it's surgery, a heart attack, endocarditis, or catheterization, these baseline tracings allow us to assess the heart's condition before and after the intervention. This comparison helps us understand the impact of treatment and monitor recovery. We also look for blocked or narrowed arteries, which can indicate issues like myocardial infarction or MI. Detecting these blockages early is vital because they can lead to serious complications if left untreated. Finally, we use ECGs to evaluate how well medications are working. By checking the heart's response to treatment, we can determine if the medicines are effective or if adjustments are needed. All these points connect back to the overall goal of providing comprehensive, continuous monitoring of heart health to ensure the best possible outcomes for patients. Now, let's talk about when it is important to pay attention to these symptoms. If you're experiencing chest pain, that's a clear sign that something could be wrong with your heart, and you should seek medical attention promptly. Similarly, dizziness, lightheadedness, or confusion can indicate decreased blood flow to the brain or other serious issues, so don't ignore these signs. Heart palpitations and a rapid pulse are also important. They can be signs of irregular heart rhythms that need evaluation. Shortness of breath is another key symptom. If you find yourself struggling to breathe or feeling breathless without a clear reason, it's time to get checked out. Lastly, if you notice weakness, fatigue, or a decline in your ability to exercise, these might seem minor at first, but they can be signs that your heart isn't working as efficiently as it should. Recognizing these symptoms early and understanding when they occur helps us catch potential issues before they become more serious. Remember, listening to your body and acting promptly can make a real difference in your health outcomes. let's take a closer look at some factors that can influence cardiac assessments. First, obesity and pregnancy are significant because they can alter the body's physiology and impact the accuracy of certain tests. For instance, excess weight or hormonal changes during pregnancy can affect the heart's functioning and how we interpret results. Fluid buildup in the abdomen, such as ascites, or in the pericardial or pleural spaces, can also complicate the picture. These conditions may change the heart's position or create additional resistance, making it more challenging to get clear readings. Anatomical considerations are equally important, specifically the size and location of the heart. Variations here can influence how electrical signals are recorded and interpreted during tests. Speaking of electrical signals, movement or activity during testing is a key factor. Any movement can introduce noise or artifacts, so ensuring the patient is as still as possible is crucial for accurate results. Electrolyte imbalances, particularly involving potassium, calcium, and magnesium, can significantly impact the heart's electrical activity. These minerals are vital for maintaining normal cardiac rhythm, so deviations can lead to abnormal readings or arrhythmias. Overall, understanding these factors helps us interpret cardiac assessments more accurately and tailor our approach to each patient's unique situation. Let's take a closer look at the different types of ECGs. First, we have the augmented limb leads, which are unipolar. These leads provide a unique perspective by augmenting the signals from the limbs, giving us a clearer view of the heart's electrical activity from different angles. Then, there are the standard limb leads, which are bipolar. These are the classic leads, measuring the electrical difference between 2 points, and they form the basis of the limb lead system. Lastly, we have the chest leads, also unipolar, which are placed directly on the chest wall. These leads give us a horizontal view of the heart and are crucial for detailed analysis of cardiac activity. Understanding these 3 types helps us see the comprehensive picture of the heart's electrical function, which is essential for accurate diagnosis and effective patient care. All right, let's take a closer look at bipolar leads. Lead I, for example, has the positive electrode placed on the left arm, while the negative electrode is on the right arm. This setup allows us to measure the potential difference between these 2 arms directly. The idea here is to capture the electrical activity across the heart from this specific angle. Now, the electrode on the right leg acts as a reference electrode. It doesn't directly measure the heart's activity, but provides a stable baseline for comparison. This setup helps us get a clearer picture of the heart's electrical signals. When we talk about standard limb leads, they're named lead I, lead II, and lead III. Each of these leads looks at the heart's electrical activity from different perspectives, giving us a more comprehensive understanding. Together, these leads form a fundamental part of the overall ECG, helping us interpret the heart's rhythm and detect any abnormalities. This understanding is crucial as we explore how these signals reflect the heart's function overall. Now let's look at lead II. In this lead, the positive electrode is placed on the left leg, while the negative electrode is on the right arm. This configuration measures the potential difference between those 2 points, giving us valuable information about the heart's electrical activity. Moving on to lead III, here the positive electrode is on the left arm, which actually acts as a negative point in this setup, and the positive is on the left leg. So, in essence, lead III measures the potential difference between the left arm and the left leg. An interesting thing to note is that these bipolar limb leads, lead I, lead II, and lead III, roughly form an equilateral triangle around the heart, and this is known as Einthoven's triangle. This geometric concept helps us understand how these leads provide different perspectives of the heart's electrical activity, giving us a comprehensive view when analyzing ECGs. Overall, these leads are fundamental because they give us different angles and insights into the heart's electrical function, which is essential for accurate diagnosis and understanding of cardiac health. Let's take a closer look at normal limb leads. The positive electrode for lead I is said to be at 0 degrees, which means it's aligned directly with the heart's electrical axis in that lead. Now, When we talk about depolarization waves traveling through the heart, their direction really matters. For example, a wave of depolarization moving at plus 60 degrees produces the greatest positive deflection in lead II. This is because the wave's direction aligns favorably with the axis of lead II, maximizing the positive signal we see on the ECG. Understanding these angles helps us interpret the electrical activity of the heart more accurately, especially when assessing normal versus abnormal conduction. So, in essence, the direction of the depolarization wave relative to the lead's axis determines the size and polarity of the deflections we observe. Let's take a closer look at augmented limb leads, also known as unipolar leads. These are named lead AVF, lead AVR, and lead AVL. Now, the term unipolar is important because it indicates that each of these leads has a single positive electrode. This positive electrode is referenced against a combined or average signal from the other limb electrodes. The key point here is that, unlike bipolar leads which use two electrodes, these augmented leads use just one positive electrode and compare it against a reference point. The positive electrodes for these leads are located on different limbs. For AVL, it's on the left arm. For AVR, it's on the right arm. And for AVF, it's on the left leg. Understanding these leads helps us see the heart's electrical activity from different angles, giving us a more comprehensive picture. They are part of the overall ECG framework that allows us to assess cardiac function accurately and efficiently. So, when we analyze these augmented leads, we're essentially looking at the heart's electrical signals from three unique perspectives, which is vital for accurate diagnosis. Let's take a closer look at the normal augmented leads. These are interesting because they use the same electrodes as leads I, II, and III, but they provide different angles of view of the heart's electrical activity. Specifically, the AVL lead is positioned at degrees relative to lead I's axis, while AVR is at minus 150 degrees, and AVF is at plus 90 degrees. Understanding these angles helps us interpret how the electrical vectors in the heart are projected onto these leads. Now, if the electrical depolarization vector is directed downward, which corresponds to plus 90 degrees, the AVF lead will show the greatest positive deflection. This means that the orientation of the lead relative to the heart's electrical activity directly influences what we see on the ECG, helping us determine the direction of the electrical wavefront. Connecting this to our overall theme, grasping these angles and their relationships is key to accurately interpreting the heart's electrical signals and diagnosing various cardiac conditions. Now, let's take a look at the 6 limb leads used in the ECG. These include the 3 augmented unipolar leads, which are a bit different from the standard bipolar leads, but together they give us a comprehensive view of the heart's electrical activity. When you combine these 3 augmented leads with the 3 standard bipolar leads, you get a total of 6 limb leads. All of these leads work together to record the electrical signals along a single plane, known as the frontal plane. This plane is essentially a vertical slice through the body that helps us visualize the heart's activity from different angles. Understanding these leads and the plane they record along is crucial because it helps us interpret the heart's electrical function in a more complete way. This is a foundational concept that supports the overall goal of ECG interpretation, getting a clear picture of how the heart is working electrically from different perspectives. Let's take a closer look at the leads and their corresponding ventricular regions. For leads V1 and V2, they primarily monitor the anterospital region of the heart. Moving to V3 and V4, these leads focus on the anteroapical area. And for V5 and V6, they are positioned to observe the anterolateral part of the ventricle. There are a total of 6 precordial, or chest, leads that are unipolar. These are named V1 through V6, and each one has a positive electrode placed on different regions of the surface of the chest. These 6 leads are crucial because they give us a comprehensive view of the electrical activity across the front of the heart. They are designed to pick up signals from specific regions, helping us localize issues or abnormalities more accurately. Remember, these chest leads are part of the unipolar chest lead system, meaning each lead has a single positive electrode, with a reference point called Wilson's central terminal. Overall, understanding the placement and the regions these leads monitor is fundamental. It allows us to interpret the ECGs more effectively and connect the electrical activity with specific areas of the heart. Before your ECG, there are a few important preparations to keep in mind. First, fasting or not eating is not required, so you can have your usual meals before the test. Make sure to take all your medicines and herbs as advised by your doctor, as skipping them can affect the results. If you have a pacemaker, it's very important to inform your doctor or technologist beforehand. Also, remove any jewelry or objects that might interfere with the test, as they could distort the readings. During the ECG, try not to talk, because movement or talking can alter the tracing and make it less accurate. If you have a lot of hair on your chest, arms, or legs, it's helpful to shave or clip small patches to ensure good contact with the electrodes. Finally, we need to check for any electrical or magnetic disturbances near the ECG machine, which could cause leakage or interference. Ensuring the environment is clear of such disturbances helps us get a clean and accurate reading. Remember, these steps are all about making sure we get the most precise information to assess your heart health effectively. Let's go through the procedure of performing an ECG. First, I will ask you to remove clothing from the waist up. Don't worry, your privacy is very important, so I will cover you with a sheet or gown, exposing only the area necessary for the test. Next, I'll ask you to lie down flat on a table or bed, which helps us get the most accurate reading. Now, I will attach the ECG electrodes to specific spots on your chest. If needed, I'll apply some ECG jelly to improve electrical conductivity, ensuring clear signals. After that, I'll connect the lead wires to these electrodes. Once everything is in place, I may need to enter some identifying information into the machine to keep your results organized. The actual ECG recording will only take a short amount of time. When it's finished, I'll disconnect the leads from the electrodes. Throughout this process, the goal is to make you comfortable while obtaining precise, reliable data about your heart's activity. This step-by-step procedure helps us get a clear picture of your heart's health, which is essential for accurate diagnosis and treatment planning. Let's take a closer look at chest positions. When we talk about chest positions, we're really focusing on how the placement and movement of the chest can impact overall performance and safety. The key points to remember are that proper chest positioning helps us maintain good posture, allows for optimal breathing, and supports efficient movement. It's important to understand that a well-aligned chest can prevent unnecessary strain and reduce the risk of injury, especially during physical activity. Throughout this presentation, we've emphasized the connection between proper body mechanics and effective performance. Chest position is a crucial part of that puzzle because it influences everything from balance to breathing efficiency. So, paying attention to how your chest is positioned, whether it's upright, relaxed, or engaged, can make a big difference in both your comfort and your results. Keep these concepts in mind as we continue to explore how body awareness enhances performance and safety. Let's take a closer look at the 12-lead ECG placement. Proper placement of the leads is crucial because it ensures accurate readings, which are essential for correct diagnosis and effective patient care. Each lead has a specific location on the body, and placing them correctly helps us visualize the heart's electrical activity from different angles. Remember, even small deviations in placement can lead to misinterpretation of the ECG, so paying attention to these details is key. Throughout this presentation, we've emphasized the importance of precision in procedures. This is a perfect example. By understanding and consistently applying the correct placement of the 12-lead ECG, we improve the reliability of the data we gather, ultimately leading to better patient outcomes. So, take your time with placement, double-check your work, and keep this key point in mind as you perform ECGs in practice. Let's take a closer look at the international color coding for electrodes and leads. This system is really important because it standardizes how we identify different leads across various devices and settings. By using specific colors, we can quickly and accurately connect the right electrodes to the correct parts of the body, which is crucial for reliable readings. The most important concept here is consistency. No matter where you're working or what equipment you're using, these colors help prevent errors and ensure patient safety. This coding system ties into the overall theme of standardization in electrocardiography, helping us maintain accuracy and efficiency in all clinical situations. Remember, familiarizing yourself with these color codes is key to smooth and accurate ECG interpretation. Let's take a closer look at the normal 12-lead ECG. This is the standard tool we use to assess the heart's electrical activity in a comprehensive way. It provides us with a detailed view of the heart's rhythm, conduction pathways, and overall cardiac health. When we look at a normal 12-lead ECG, we're expecting to see consistent P waves, regular QRS complexes, and a normal SD segment and T wave, all of which indicate that the heart's electrical system is functioning properly. These 12 leads give us different angles and perspectives, allowing us to pinpoint the exact location of any abnormalities if they are present. Understanding what a normal ECG looks like is fundamental, because it sets the baseline for identifying deviations that may signal pathology. This slide reminds us that a thorough knowledge of a normal 12-lead ECG is essential in our overall assessment of cardiac health and in making accurate diagnoses. Now, let's take a look at some other types of ECG monitoring devices. First, we have the Holter monitor. This is a small, wearable device that continuously records your heart's activity over a period, usually 24 to 48 hours. It's great for capturing irregularities that might not show up during a brief exam. Then there's the event monitor. Similar in appearance to the Holter, but designed for longer-term use, often up to 30 days. It records only at specific times, either when you press a button because you're experiencing symptoms or automatically if it detects an irregular rhythm. This makes it especially useful for sporadic or infrequent issues. Both devices help us get a clearer picture of your heart's activity over time, fitting into our overall goal of accurate diagnosis and effective management. A treadmill test, also known as an exercise stress test or exercise electrocardiogram, is a valuable tool in assessing heart health. It helps us determine if you might be at risk for heart disease, which is crucial for early detection and prevention. Additionally, the test tells us how much exercise your heart can handle safely. This is important because it guides us in understanding your physical limits and planning appropriate activity levels. During the test, you'll be asked to walk on a treadmill, and as you do, we monitor your heart's performance in real time. We're looking at how your heart responds to increased activity, especially watching for signs of arrhythmia or any abnormal blood supply. The goal is to see how your heart copes under stress and to identify any issues that might not be apparent when you're at rest. This way, we can better assess your cardiovascular health and make informed decisions about your lifestyle and treatment options. Overall, this test plays a key role in the broader picture of maintaining your heart health and preventing serious conditions down the line. All right, let's talk about interpretation. When it comes to reading an ECG, there are actually quite a few different systems or approaches we can use to analyze the data. The first thing we need to consider is the patient details, things like age, history, and presenting symptoms, as these give us context for what we're seeing on the ECG. Next, we look at the situation details, whether it's an emergency, routine check, or follow-up, which helps guide our interpretation. Then, we move into examining the rate, which is how fast or slow the heart is beating, and the rhythm to determine if it's regular or irregular. The axis is another key point. It tells us about the overall direction of the electrical activity. We also need to carefully evaluate the P wave and the PR interval, because they inform us about atrial activity and conduction from the atria to the ventricles. Then, we look at the Q wave and the QRS complex, which are crucial for understanding ventricular depolarization and potential issues like infarcts. The SD segment is vital for detecting ischemia or injury, so we scrutinize it closely. The QT interval gives us information about the total time for ventricular depolarization and repolarization, which can be important for identifying risk of arrhythmias. Lastly, we analyze the T wave, which reflects ventricular repolarization. By systematically assessing all these components, we can piece together a comprehensive interpretation of the ECG. Remember, mastering this process is essential for accurate diagnosis and effective patient care. Let's start by looking at the patient details. It's important to note the patient's name, date of birth, and gender, as these help us accurately identify and contextualize the ECG findings. The location where the ECG was performed can also be relevant, especially if multiple sites are involved. Remember to check the date and time of the recording. It helps us understand the timing of the event or condition we're assessing. Additionally, ensuring proper calibration of the ECG is crucial. Typically, this is set at 25 millimeters per second for paper speed and 10 millimeters per millivolt for amplitude. Proper calibration ensures that the measurements are accurate and comparable. Moving on to the patient situation, we need to know exactly when the ECG was taken. Was it during symptoms or at rest? This context can influence how we interpret the results. It's also vital to gather information about any symptoms the patient was experiencing at the time, such as chest pain, palpitations, or dyspnea, and whether the ECG was performed during exercise. These details help us understand the clinical scenario better. We should also consider any cardiac devices like pacemakers, previous surgeries, or interventions, as these can affect the ECG pattern. Lastly, reviewing the patient's medications and iron levels is important because they can influence cardiac conduction and rhythm. Connecting all these points helps us form a comprehensive picture, which is essential for accurate diagnosis and effective management. Now, let's take a look at normal heart rates. A normal resting heart rate for adults typically falls between 60 and 100 beats per minute. When the heart beats within this range, it's generally considered healthy and efficient. However, when the heart rate exceeds 100 beats per minute, we call that tachycardia. This can happen for various reasons, like stress, fever, or underlying medical conditions, and it may require further assessment. On the other hand, if the heart rate drops below 60 beats per minute, it's known as bradycardia. Sometimes, bradycardia can be normal, especially in athletes, but it can also indicate issues with the heart's electrical system or other health concerns. Understanding these ranges helps us evaluate patients' heart function and identify potential abnormalities early. Remember, the overall rhythm and how the heart's electrical impulses coordinate are just as important as the rate itself in assessing cardiac health. Let's talk about how to calculate heart rate when the rhythm is regular. First, we need to look at the RR interval, which is the time between two consecutive R waves on the ECG. To do this, we count the number of large squares that fit within one RR interval. Once we have that number, the next step is to divide 300 by it. This gives us the heart rate in beats per minute. For example, if you count 4 large squares within an RR interval, then you divide 300 by 4, which equals 75 beats per minute. Now, a quick reminder about the numbers behind these calculations. Because one large square on the ECG paper represents 0.2 seconds, 300 divided by 0.2 seconds per large square equals 1500. This helps us understand the scale and why these calculations work. So, to sum up, counting the large squares within an RR interval and dividing 300 by that number is a quick, effective way to estimate heart rate when the rhythm is regular. It's a fundamental skill in ECG interpretation that ties into the overall goal of assessing cardiac function efficiently. When a patient has an irregular heart rhythm, the usual method of calculating heart rate by measuring the RR interval doesn't really work. That's because in irregular rhythms, the RR intervals can vary significantly throughout the ECG, making it unreliable to rely on that method alone. Instead, what we do is count the number of complexes on the rhythm strip. Typically, a rhythm strip is about 10 seconds long. Once you've counted how many complexes are present in that period, you multiply that number by 6. This gives you an estimate of the average number of complexes, or heartbeats, per minute. For example, if you count 10 R waves on the strip within those 10 seconds, you multiply 10 by 6, which equals 60 beats per minute. That's your heart rate estimate. And just a quick note on timing. Each large box on the ECG paper represents about 0.2 seconds, so 5 large boxes make 1 second, and 50 large boxes equal 10 seconds, making it easy to identify the correct time frame for counting. So, in summary, when dealing with irregular rhythms, counting the complexes and multiplying by 6 gives you a quick, practical way to estimate heart rate accurately. This method is especially important to connect to overall patient assessment and management. When dealing with fast heart rhythms, you might notice that 2 consecutive R waves are really close together. In fact, they can be so close that it's hard to accurately estimate the heart rate just by counting the larger squares on the ECG. So what do we do in those cases? Well, we identify 2 consecutive R waves and then count the number of small squares, those tiny 0.04 second segments between them. Once we have that number, we divide 1500 by it. This gives us the heart rate in beats per minute. Remember, this method is especially useful when the rhythm is fast, and the usual methods might not be precise. It's a handy tool for quickly and accurately assessing heart rate even when the waves are racing by. Now, let's talk about the normal cardiac axis. The cardiac axis essentially describes the overall direction in which the electrical impulses spread across the heart. In a healthy individual, this electrical activity generally follows a specific path, spreading from roughly 11 o'clock to 5 o'clock. This range indicates a normal, well-aligned heart. To determine whether the cardiac axis is within this normal range, we need to look at the ECG leads, specifically leads I, II, and III. These leads give us a good view of the heart's electrical orientation. By analyzing the patterns in these leads, we can assess if the electrical activity is moving in the expected direction, which helps confirm that the heart's conduction system is functioning properly. Understanding the cardiac axis is important because deviations from the normal range can indicate underlying issues, such as hypertrophy or conduction abnormalities. So, in the context of overall cardiac health, assessing the axis is a fundamental step in ECG interpretation. Let's start by looking at the normal cardiac axis. When we analyze the electrical activity of the heart, lead II typically shows the most positive deflection compared to leads I and III. This indicates the general direction of the heart's electrical conduction during a normal rhythm. Now, when we encounter right axis deviation, the key points change a bit. In this case, lead III shows the most positive deflection, and lead I should be negative. This shift in the axis suggests that the electrical activity is directed more towards the right side of the heart. This is important because right axis deviation is often associated with right ventricular hypertrophy. Essentially, when the right ventricle enlarges or becomes more muscular, it can influence the overall electrical axis, causing this deviation. Understanding these patterns helps us identify underlying cardiac conditions and guides further diagnosis and management. So, recognizing the difference between normal and right axis deviation is crucial in interpreting ECGs accurately. All right, let's talk about left axis deviation. When we look at lead I, you'll notice it has the most positive deflection, which means the electrical activity is moving toward that lead. Conversely, leads II and III tend to be negative in this case, indicating the electrical vector is shifted away from them. This shift in the electrical axis is often associated with heart conduction abnormalities, such as left anterior fascicular block or hypertrophy. Recognizing this pattern helps us understand underlying issues with the heart's conduction system and guides us in further assessment. Remember, identifying axis deviations is a key part of interpreting ECGs and diagnosing cardiac conditions accurately. Let's talk about P waves. These are the first waves to arrive during an earthquake, which makes them particularly important in seismology. P waves, or primary waves, are compressional waves that travel through both solid and liquid layers of the Earth. They move by pushing and pulling the ground in the direction of wave propagation, kind of like how sound waves work. Because they travel faster than other seismic waves, they are the earliest indicator of an earthquake on seismographs. Understanding P waves is crucial because they help us determine the earthquake's origin time and distance. They also provide valuable information about the Earth's internal structure, since their speed varies depending on the material they pass through. So, in the context of earthquake detection and analysis, P waves are fundamental. They're our first alert and a key to unlocking what's happening beneath our feet. Let's take a closer look at the P waves on this ECG. First, we want to ask, are P waves present at all? If they are, the next step is to see if each P wave is followed by a QRS complex, which indicates that the atrial activity is successfully conducted to the ventricles. Now, if you do see P waves, it's important to assess whether they look normal. Check their duration, which should be consistent, their direction, usually upright in lead II, and their shape. Normal P waves are a key indicator of healthy atrial activity. If P waves are absent, don't jump to conclusions right away. Instead, look for any signs of atrial activity. Sometimes, instead of normal P waves, you might see a sawtooth baseline, which suggests atrial flutter waves. If the baseline appears chaotic, that points toward fibrillation waves, indicating atrial fibrillation. And if there's a flat line with no activity, that suggests there's no atrial activity at all. Understanding these variations helps us interpret the rhythm correctly and guides our next steps in patient management. So, always carefully analyze the P waves, or lack thereof, to get a complete picture of atrial activity. Now, let's look at the PR interval. The normal range for the PR interval is between 120 and 200 milliseconds, which corresponds to about 3 to 5 small squares on the ECG. If the PR interval is longer than 200 milliseconds, or more than 0.2 seconds, it suggests there might be some delay in the atrioventricular conduction, known as AV delay. When this delay becomes prolonged, it can indicate a type of heart block called first-degree heart block. This condition involves a consistently prolonged PR interval that stays fixed and above the normal range. Recognizing these changes is important because they can be early signs of conduction issues within the heart, and understanding these patterns helps us connect the dots in diagnosing different types of arrhythmias or conduction delays in our overall assessment. Now, let's talk about second-degree heart block, specifically type 1, which is also known as Mobit's type 1 AV block or the Wenckebach phenomenon. This type of AV block is characterized by a progressive lengthening of the PR interval on the ECG. What that means is, each time an atrial impulse travels through the AV node, the conduction gets a little slower. Eventually, this delay becomes so long that the impulse is not conducted at all, leading to a dropped QRS complex. In other words, you'll see the PR interval gradually getting longer with each beat until suddenly, an atrial impulse fails to make it through, and the QRS complex is missing. After this missed beat, normal conduction resumes, and the cycle begins again. This repeating pattern of progressive PR prolongation, followed by a dropped beat, is a key feature of Mobit's type 1. It highlights the dynamic nature of AV nodal conduction and helps us distinguish it from other types of heart block. Understanding this pattern is crucial because it reflects a transient, often benign, conduction abnormality that we see in various clinical scenarios. Second-degree heart block, specifically type 2, is also known as Mobit's type 2 AV block. In this condition, the ECG typically shows a consistent PR interval, which means the time between the P wave and the QRS complex stays the same. However, what stands out is that some QRS complexes are intermittently dropped, meaning they fail to appear when they should. This happens because of a failure in conduction through the AV node or His-Purkinje system. A key feature to remember is that the dropped QRS complexes tend to follow a repeating pattern. For example, in a 3-1 block, every third P wave is not followed by a QRS, and in a 4-1 block, every fourth P wave is missed. Recognizing this pattern is crucial for diagnosis and distinguishing it from other types of AV blocks. Understanding these ECG findings helps us grasp the seriousness of Mobitz type 2, as it can progress to complete heart block. Connecting this to the broader theme of conduction disturbances, it highlights the importance of identifying patterns and understanding their implications for patient management. Degree heart block, also known as complete heart block, occurs when there's no electrical communication between the atria and the ventricles. This happens because the conduction pathway fails entirely. As a result, you'll see P waves and QRS complexes on the ECG that are completely independent of each other, meaning they don't have any relationship or synchronization. The atria and ventricles are essentially functioning independently in this situation. Despite this disconnection, the heart can still maintain some level of cardiac function because a junctional or ventricular pacemaker takes over to generate the heartbeat. This is an important concept because it highlights how the heart can adapt to conduction problems, but it also underscores the significance of identifying and managing complete heart block promptly. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide.